Welcome to another easy nursing review. In this lesson, we will cover diabetic ketoacidosis. But before we begin, let's see if you can get this answer correct. The scientific explanation for Kussmaul's respirations in the patient with diabetic ketoacidosis is best explained by which statement? 1. The kidneys produce excess urine and the lungs try to compensate. 2. The respirations increase the amount of carbon dioxide in the bloodstream. 3. The lungs speed up to release carbon dioxide and increase the pH. 4. The shallow and slow respirations will increase the bicarbonate in the serum. Comment what you think the answer is in the comments below. Now let's begin by first learning what is type 1 diabetic ketoacidosis. This disorder, which is caused by a significant lack of insulin, making this life-threatening. The lack or significantly insufficient amount of insulin is the cause of diabetic ketoacidosis. This leads to problems with how fat, protein, and carbs are metabolized. Keep in mind that patients with type 1 diabetes are the ones that experience this the most. Reduced or missed insulin dosage, disease or infection, and early signs of undiagnosed or uncontrolled diabetes are the three main causes of diabetic ketoacidosis. Key thing to note is that this is a very sudden onset and happens quickly. Now, here are the signs and symptoms of the patient. Now, remember that the three main clinical features of diabetic ketoacidosis are 1. Hyperglycemia, due to decreased use of glucose by the cells and increased production of glucose by the liver. 2. Dehydration and electrolyte loss, resulting from polyuria, with a loss of up to 6.5 liters of water and up to 400 to 500 each of sodium, potassium, and chloride over 24 hours. And 3. Acidosis, due to an excess breakdown of fat to fatty acids and production of ketone bodies, which are also acids. Now, the other additional signs of symptoms are the following: elevation in blood glucose levels typically between 300 and 800, decreased pH of blood, ketonuria, polyuria and polydipsia, acetone breath, Kussmaul respirations, which are hyperventilation with very deep but not labored respirations, electrolyte imbalance, and dehydration. Now let's go over important labs as they will reflect the following: a blood glucose level in the range of 300 to 800, a low serum bicarbonate level 0 to 15, a low pH 6.8 to 7.3, a low partial pressure of carbon dioxide, 10 to 30 millimeters of mercury. Sodium and potassium levels may be low, normal, or high depending on the amount of water loss. Elevated creatinine, blood urea nitrogen, and hematocrit values may be seen with dehydration. After rehydration, continued elevation in the serum creatinine and blood urea nitrogen levels suggests underlying renal insufficiency. Okay, let's move on and learn about treatments for diabetic ketoacidosis. In terms of the goal of treatment and medications, just think: rehydration, restoring, and reversing. Rehydration. This is done to restore circulating fluid volume, initiated with normal saline until blood sugar levels reach 250 to 300, at which point the client is typically switched to a solution containing dextrose such as D5W or D5 normal saline. Insulin. Regular insulin is administered intravenously to treat hyperglycemia and acidosis. Note that intravenous insulin administration will continue until the client is stabilized and subcutaneous administration can be resumed. Blood sugar levels are monitored closely, sometimes at least hourly, until stabilized. Also note that potassium levels may be compromised due to dehydration, so levels should be monitored frequently to assess for the need for replacement. Back to that question at the very beginning of the video. The scientific explanation for Kussmaul's respirations in the patient with diabetic ketoacidosis is best explained by which statement? 1. The kidneys produce excess urine and the lungs try to compensate. 2. The respirations increase the amount of carbon dioxide in the bloodstream. 3. The lungs speed up to release carbon dioxide and increase the pH. 4. The shallow and slow respirations will increase the bicarbonate in the serum. And the correct answer is 3. This is because the lungs attempt to increase the blood pH level by blowing off the carbon dioxide. If you got it right, awesome. If not, that's okay. Just keep studying. Bonus nursing tip. Okay, so one way to remember treatment of diabetic ketoacidosis is to think KING, UFC. K for potassium, I for insulin, N for nasogastric tube, G for glucose once the serum drops, U for urea monitoring, F for fluids such as crystalloids, C for creatinine, which also needs to be monitored. Well, that ends this lesson. Click here for another nursing video.